Not true about the anal canal is completely lined by stratified squamous epithelium. So what is true about anal canal is it is supplied by pudendal nerve, it is drained by veins forming portosystemic anastomosis, and part below pectinate line is supplied by inferior rectal artery, which is the direct branch of celiac trunk, left gastric. Vein draining to inferior vena cava is right suprarenal vein. True about boundaries of lesser sac is greater omentum. Cystic artery arises from right hepatic artery. Superficial perineal muscles include superficial transverse perineae, bulbospongiosus, and ischiocavernosus. The branch of anterior division of internal iliac artery includes uterine artery, obturator artery, and internal pudendal artery. Cremasteric muscle is supplied by genital branch of genitofemoral nerve. Blood supply of left ureter are uterine artery, inferior vesical artery, testicular artery, and common iliac artery. True about inferior vena cava, it forms the posterior wall of the epiploic foramen and it is related to psoas muscle. True about inguinal canal, it is an intermuscular canal. Superficial inguinal ring is situated superior and lateral to pubic tubercle. In male, vas deferens passes through it, artery and nerve supply pass through it. Left ureter is related to left gonadal vessels, sigmoid mesocolon, and internal iliac artery. Blood supply of stomach is left gastric artery, short gastric artery, and left gastroepiploic artery. The cisterna chyli are situated in the abdomen. Length of male adult urethra is 20 centimeters. Length of female adult cervical canal is 2.5 centimeter. Ureter crosses all of the following except inferior mesenteric artery. So ureter crosses uterine artery, bifurcation of common iliac and sigmoid mesocolon. The blood vessel related to the paraduodenal fossa is inferior mesenteric vein. A posteriorly perforating ulcer in the pyloric antrum of the stomach is most likely to produce initial localized peritonitis or abscess formation in the omental bursa, that is lesser sac. While exposing the kidney from behind, all of the following nerves are liable to injury except lateral cutaneous nerve of thigh. So which nerves are liable to injury? Ilioinguinal nerve, subcostal nerve, and iliohypogastric nerve. Infection or inflammation of all of the following causes enlarged superficial inguinal lymph node except penile urethra. So infection or inflammation of which organs causes enlarged superficial inguinal lymph node? Isthmus of uterine tube, inferior part of anal canal, and big toe. The intricately and prodigiously looped system of veins and arteries that lie on the surface of the epididymis is known as pampiniform plexus. Which of the following is true about location of omental bursa? Left subhepatic. Ejaculatory duct opens into prostatic urethra. A common structure in Hazelback triangle and femoral triangle is inguinal ligament. The efferent limb of the cremaster reflex is provided the genital branch of the genitofemoral nerve. Fructose, a source of energy for spermatozoa, is found primarily in the secretion from the seminal vesicle. The relation of sympathetic trunk to inferior vena cava is left. Cave of Ritzius is found in front of the bladder. The lymphatic of vulva transfers the labia from medial to lateral side. The inferior hypogastric plexus is located on the side of rectum. Ligamentum teres of the liver is remnant of left umbilical vein. Venous blood of liver is drained by hepatic vein. Which of the following is true about splenic artery? It gives short gastric artery along the fundus. The free edge of the falciform ligament encloses ligamentum teres. All of the following form visceral relation of spleen except adrenals. So what are the visceral relations of spleen? Stomach, splenic flexure of colon, and kidney. The main antagonistic muscle of rectus abdominis muscle is erector spinae. To create a portocaval shunt in a patient with portal hypertension, which of the following venous anastomosis should be performed? Left splenic vein to left renal vein. Which of the following arteries is a direct branch of the gastroduodenal artery? Right gastroepiploic artery. True about the anatomy of inguinal hernia, which is true? Superficial inguinal ring is an opening in external oblique aponeurosis. Posterior wall is formed by transversalis fascia and conjoint tendon. Indirect hernia lies anteromedial to spermatic cord. True about ureter, it starts at the hilum, changes its direction at the ischial spine, penetrates the bladder wall without any valve, enters the bladder at the lateral angle of the trigone, enters pelvis in front of bifurcation of common iliac artery. The diaphragm is formed of the following except dorsal mesentery of esophagus. So diaphragm is formed of septum transversum, paraxial mesoderm and pleuroperitoneal membrane. Ureteric constriction is seen at all the following position except ischial spine. So ureteric constriction is seen at uretropelvic junction, uretrovesical junction and crossing of iliac artery. All of the following statements concerning the ductus deferens are correct except that it begins in the head of the epididymis. So which are the statements concerning ductus deferens? It ascends in the spermatic cord, it joins the duct of seminal vesicle to form the ejaculatory duct, and it descends medial to the ureter and seminal vesicles. The artery of the ductus deferens arises from which of the following structure? Inferior vesicle. All of the following statements about the splenic artery are true except that it has branches that anastomose freely within the spleen. So which statement about splenic artery are true? It has a tortuous course, it is a branch of the celiac trunk and it supplies the greater curvature of stomach. The narrowest part of the ureter is at the uretrovesical junction. Benign prostatic hypertrophy results in obstruction of the urinary tract. The specific condition is associated with enlargement of the median lobe. The prostatic urethra is characterized by all of the features except that it presents a concavity posteriorly. So, which are the features of prostatic urethra? It is widest and most dilatable part. It lies closer to anterior surface of prostate. It receives prostatic ductules along its posterior wall. All of the following statements regarding vas deferens are true except it is separated from the base of bladder by peritoneum is incorrect. So what is correct is the terminal part is dilated to form ampulla. It crosses the ureter in the region of ischial spine. It passes lateral to inferior epigastric artery at deep inguinal ring. The following group of lymph nodes receive lymphatic from the uterus except deep inguinal. So which lymph node receive lymphatic from uterus? External iliac, internal iliac and superficial inguinal. In an adult male on per-rectal examination, the following structure can be felt anteriorly except internal iliac lymph node. So the bulb of the penis can be felt, prostate can be felt and seminal vesicle when enlarged can be felt. The gastroduodenal artery is derived from hepatic artery. The neck of pancreas is related on its posterior surface to superior mesenteric vein. Lymphatic drainage of the cervix occurs by all of the following lymph node except deep inguinal lymph node. So lymphatic drainage of the cervix occurs by parametrial lymph node, obturator lymph node and external iliac lymph node. All of the following are the components of the white pulp of spleen except vascular sinus. So which are the component of white pulp of spleen? Periarterial lymphoid sheath, B cells and antigen presenting cells. True statement about appendix is it develops from midgut and supplied by appendicular branch of ileocolic artery. True statement about lower VJP anterior abdominal wall is linea alba is poorly formed and external oblique is poorly formed. Superficial perineal muscle include bulbospongiosis. Atherosclerotic occlusion of which artery would result in insufficient perfusion of urinary bladder, internal iliac. Most medially located renal structure is renal pelvis. Pyramidalis is supplied by subcostal nerve. Right kidney's anterior relation all are devoid of peritoneum except liver. So duodenum, suprarenal gland and colon is devoid of peritoneum on the right side. Which one of the following ligament contains splenic artery? Splenorenal ligament. The segmental division of liver into 8 segments is based on hepatic vein and portal vein. Stomach derives its blood supply from all of these arteries directly or indirectly except superior mesenteric artery. So, which are the vessels supplying the stomach directly or indirectly? Splenic artery, hepatic artery, and celiac axis. Structure that does not cross the midline is left gonadal vein. So, which structure cross the midline? Left renal vein, left brachiocephalic vein, and hemiazygous vein. Portosystemic shunt is not seen in spleen, it is seen in liver, anorectum, and gastroesophageal. Injury to male urethra below the perineal membrane causes urine to accumulate in the superficial perineal pouch. All are true. The trigone of the urinary bladder, except mucosa, is loosely associated to the underlying musculature. So, what is true about trigone of urinary bladder? Mucosa is smooth, it is lined by transitional epithelium, and it is derived from the absorbed part of the mesonephric duct. Supports of the uterus are all except broad ligament. So supports of uterus are uterosacral ligament, Mackenrod's ligament, and levator ani. Renal angle lies between 12th rib and lateral border of sacrospinalis. Pudendal nerve supplying motor part to external sphincter is derived from S2 to S3 roots. Ureteric constriction in the following sites except at mesentery. So ureteric constriction is at the pelviureteric junction. It crosses the internal iliac artery and at the bladder wall. Tail of pancreas is related with splenicorenal ligament. Watershed area between SMA and IMA, which commonly result in ischemia, is splenic flexure. True about left renal vein, posterior and inferior to superior mesenteric artery. In fracture of penis involving rupture of tunica albuginea with intact Buck's fascia, following would be noted clinically. Hematoma involving only the shaft of penis. Shortest part of the colon is ascending colon. Ureteric constriction in the following site except ischial spine. So ureteric constriction is at pelviureteric junction, uretrovesical junction, and crosses the internal iliac artery. All are true about thoracolumbar fascia except it is attached to spinous process of lumbar vertebrae. So what is true about thoracolumbar fascia? Origin to the transversus and internal oblique muscle. Lumbar part situated in the interval between the iliac crest and the 12th rib. Attachment to the transverse process of lumbar vertebrae. Venous spread in carcinoma rectum reaches to the following structure. Liver. Referred pain in external hemorrhoid is due to inferior rectal nerve. Which of the following is the correct order of pathway for a sperm? Straight tubules, then rete testis, and then efferent tubules. Which of the following vein is found in relation to the paraduodenal fossa? Inferior mesenteric vein. The artery to the ductus deferens is a branch of superior vesical artery. True about valves in portal venous system is the whole system is valveless. All are the contents of the deep perineal pouch except bulb of penis. So which are the contents of deep perineal pouch? Bulbourethral gland, internal urethral sphincter, and dorsal nerve of penis. About ureter, true is that it is 25 cm long, it is totally retroperitoneal, and it enters the true pelvis after crossing iliac vessel. Middle lobe of prostate is present in between prostatic urethra and ejaculation duct. Deep perineal pouch contains membranous urethra. The lymphatic drainage of testis is para-aortic lymph node. In rectus sheath, which branch of aorta make anastomosis with superior epigastric artery, external iliac artery? Which of the following is not a permanent mucosal fold? Gastric ruga is not a permanent mucosal fold. Which are the permanent mucosal fold? Spiral valve of Hester, plica semilunaris, and transverse rectal fold. Spleen projects into the following space of peritoneal cavity, greater sac. Which of the following is the terminal group of lymph node for colon? Pre-aortic. All of the following are branches of splenic artery except right gastroepiploic artery. So which are the branches of splenic artery? Short gastric artery, hilar branches, and arteria pancreatica magna. Content of deep perineal pouch include all of the following except root of penis. So what are the contents of deep perineal pouch? Dorsal nerve of penis, bulbourethral gland, and sphincter urethrae. Urogenital diaphragm is made up of the following except Cooley's fascia. So urogenital diaphragm is made up of deep transverse perineus, perineal membrane, and sphincter urethrae. Lymphatic from the spongy urethra drain into the following lymph node: deep inguinal lymph nodes.